Hello, my name is Dr. J. Today we will be taking care of a patient who is experiencing postpartum hemorrhage, or PPH. PPH is the leading cause of maternal death worldwide. About 122,500 women bleed to death after childbirth every year, or about one death every 4 minutes. PPH is defined as having a blood loss of more than 500 milliliters following a vaginal delivery, or about 1,000 milliliters following a cesarean delivery. One of the most common causes of PPH is uterine atony, or the failure of the uterus to contract and retract back down following the delivery of the baby. However, there are certain factors that may put you at more risk for developing PPH. Some of those include having PPH in a previous pregnancy, having a precipitated or a prolonged labor, being over the age of 40, and being obese. But 70% of PPH is caused by uterine atony. Today we have one of our newest nurses, Shannon, taking care of our patient, Mama S.
Hi, I'm Shannon. I'll be your nurse today. How are you feeling?
I'm good, Shannon. How are you?
Good. I'm just going to take your vitals really quick and see how you're doing after the baby.
Okay.
Can I take the baby and put him?
You sure can.
Thank
Bye,
you.
Michael. Bye, sweetheart.
He'll be fine. He'll just be in the...
I have a question for
Sure.
you. My heart's racing. Is that
Okay.
normal?
Or let's check you out and see how you're doing. Can you
Okay,
put this
thank
on?
you. Thank you.
Thanks.
Appreciate that.
Mm-hmm.
Okay.
Good.
Mama S's heart rate was 122. This is too high, so we need to do some further intervention. Some nursing interventions for PPH require very close observation and documentation of the mother's vitals, blood loss, and uterine tone and size. The uterus should continue to be monitored even after the delivery of the placenta. This can be done by palpating the fundus. The uterus should be massaged frequently to express any further clots that have accumulated in the case of postpartum hemorrhage.
Okay, so next we're going to just assess your fundus, which is the top of the uterus.
Fundus? What? Fundus?
Yeah.
What is that?
So when the baby is inside your uterus, it stretches out, and the top of your fundus is the top of your uterus.
Oh.
So typically we want to see the uterus contract back down to the size of a fist, which takes about 6 weeks.
Okay.
So I'm just going to assess and see
Okay.
how you're feeling.
Oh, that's a little painful.
I know, I'm sorry.
Oh, I feel something coming through my legs.
Do you? Okay,
Yeah,
let me check
something
and
warm.
assess your pad.
It's something warm.
Oh, okay.
Oh, what do you see?
I'm seeing a little bit of clotting.
Oh, I'm a little nervous.
It's okay.
Okay.
Just means
Promise?
It's just because your fundus is soft. We
Okay.
typically want it to be contracting back down after labor, so we'll have to give you some medicine to help with that.
I
Don't
feel
worry.
like out of breath here. Oh.
Okay, so unfortunately it does look like Mama S is experiencing postpartum hemorrhage. Signs and symptoms of this will be heavy vaginal bleeding that leads to signs and symptoms of hypovolemic shock. The patient will present with a high heart rate and a low blood pressure. Blood loss is almost always underestimated because of clots, so it is best to weigh the pad and get the accurate weight of the blood. To do this, simply weigh the pad and then go ahead and weigh a normal pad. Subtract the difference, and this will give you your estimated blood loss, or EBL.
So right now we're going to weigh the pad and see how much blood there is. Roughly 0.45 pounds. Hi, Dr. J. This is Shannon in the nursing room 109.
Hi, Shannon.
Mama S has a lot of bleeding, and I'm thinking it's a postpartum hemorrhage. Her vitals are BP 90 over 48, heart rate 122, and pulse ox 92. I also weighed her pad, and it was 0.45 pounds. Do you think we should get an order for Methergin, Cytotec, or Nubane?
Oh no, okay. Yeah, that sounds like some blood loss. Let's go ahead and order the Nubane for her pain, and we can do Methergin to help her uterus decrease in size and stop the bleeding.
Hi, Mama S.
Hi,
I talked to Dr. J, and we're going to get you an order for Nubane, which is going to help you with the hemorrhage that you're having right now.
Oh, okay. Is it
Yes.
safe? Is it good?
Yeah.
It's not going to make me woozy, is it?
No, you'll be okay.
Okay,
Yeah.
thank you,
I'm
you.
also going to go ahead and put some socks on because you're now a fall risk just because of the bleeding.
Okay.
No big deal. You're just going to have to stay in bed.
Okay. How's
Okay.
my Michael doing?
Good. He's right
Okay.
here.
Give him a big hug and
You
kiss
can
from
have him
Mom.
back now.
Oh, thank you. Hi, Michael. Mommy's gonna be okay. Yeah, Mom's gonna be just fine. Good boy, Michael. No crying, no crying. Oh, that feels warm. Thank you.
Hi, how
Hi,
are you?
Shannon. How am I doing?
Good. I'm just going to take the baby and do a little bit of an assessment on you since we gave you the new vein.
Okay,
Can I
okay.
take him?
Absolutely.
Thank you.
Bye, Michael. See you in a little bit.
All right, how are you feeling after the new vein?
I feel a little tightness on
You
my
do?
chest.
Do you have asthma?
I do.
Oh, okay.
Uh-oh. One of the contraindications for Nubane is bronchial asthma. So we will have to put an order in for Narcan, which is the antidote for the Nubane.
Shannon.
Hi, I spoke with the doctor and we're going to do, I'm going to give you an antidote to reverse the reaction that you have with asthma.
Okay, thank you so
Okay.
much.
I'm going to give you your baby back and you
Okay.
guys can just rest the rest of your stay. You
Aw.
should be okay now.
Thank you.
You're
Appreciate
welcome.
that. You're such a good nurse.
Thanks.